You wake up in the morning feeling foggy, a little heavy in the head, not quite rested, and you tell yourself it was just a bad night of sleep. Your blood pressure reading at the doctor's office was fine last month. You feel reasonably well during the day, so everything must be alright. I need you to sit with that assumption for a moment, because it may be the most dangerous one you are carrying right now. If this channel has ever given you something worth knowing, hit that subscribe button right now, leave a like, and drop a comment below, because that is what allows this kind of conversation to keep reaching the people who genuinely need it. I'm Dr. Mercer, and this channel exists to bring you the latest evidence-based research on senior health, simplified and designed for adults over 60. Stay with me through this entire video, because by the end you will know exactly which 3 tests to request at your next appointment, which things in your home may be silently raising your blood pressure overnight, and one timing change to discuss with your physician that the evidence shows could cut your cardiac risk dramatically. Let's begin with the core problem that almost nobody talks about. When your doctor checks your blood pressure during an office visit, that measurement lasts approximately 30 seconds. 30 seconds out of 86,400 seconds in a single day. And the vast majority of those remaining seconds, you are asleep. That 30-second snapshot is what your entire treatment approach is built upon. And here is what that snapshot systematically misses. Under healthy conditions, your blood pressure does something essential during sleep. It drops by roughly 10 to 20% every single night. Physicians call this the dipping pattern. It is not optional. It is your cardiovascular system performing critical overnight maintenance. Your heart repairs tissue. Your blood vessels recover from the day's demands. Your kidneys process waste. Every one of these processes depends on that nighttime pressure reduction. But after 60, this system becomes less reliable. The arteries gradually stiffen. The autonomic nervous system, which controls that nighttime dip, starts losing its rhythm. Its signals weaken. For millions of adults over 65, that protective dip simply stops happening. The pressure stays elevated during sleep, or in some cases rises even higher. You wake up tired and mentally foggy, and you assume you simply slept poorly. The actual explanation is something quite different, and most physicians never measure it because they are only looking at that 30-second snapshot. The Hygieia chronotherapy trial, one of the largest cardiovascular studies ever conducted, followed more than 19,000 patients with hypertension over a median of 6 years. Published in the European Heart Journal, it found that patients who took their blood pressure medication at bedtime rather than in the morning had a 45% lower risk of cardiovascular death, heart attack, and stroke. 45% from a timing change alone, with no change in medication, no change in dose. That finding should have changed the conversation in every physician's office the day it was published. For many patients, it still has not. Now let me walk you through the specific ways this silent problem causes damage, and the things inside your home that may be making it significantly worse. The first mechanism is the non-dipper pattern, and the numbers here are striking. More than 50% of adults over 65 are what clinicians call non-dippers, meaning their blood pressure does not fall during sleep the way it should. That is not a rare edge case. That is the majority of people in that age group. Non-dippers carry a cardiovascular mortality risk 3 times higher than dippers with identical daytime readings. 3 times higher risk, with the same office reading, the same medication, the same diet, simply from what is happening during those 8 hours of sleep that nobody is measuring. There is an even more dangerous pattern called reverse dipping, where blood pressure actually rises during sleep, higher at night than during the day. For reverse dippers, stroke risk increases by a factor of 4 to 5. And these individuals feel completely normal during a standard office visit. I had a patient I will call Marcel. He came in with a textbook daytime reading of 120/78. I fitted him with a 24-hour ambulatory monitor and sent him home. By 2 in the morning his pressure had reached 164/102 while he slept completely unaware. That is not a mild elevation. That is a hypertensive crisis occurring silently, night after night, in a man who was told his blood pressure was perfectly controlled. The second mechanism is something already sitting in many homes, and it surprises nearly every patient I raise it with. Licorice root. It appears in herbal evening teas marketed as calming and natural. But licorice root contains a compound that blocks a specific enzyme in the kidneys. Without that enzyme, cortisol accumulates in the bloodstream. Elevated cortisol at night prevents the normal pressure dip and can cause a significant surge during sleep. You do not feel it happening. You simply wake up exhausted with no clear explanation. Licorice root hides on labels under the names glycyrrhiza, sweet root, or simply natural flavoring buried inside herbal blends. Check your evening tea tonight. The third mechanism is evening alcohol. And what I am about to describe surprises even moderate drinkers. The initial sedative effect of alcohol does temporarily lower blood pressure. But 3 to 4 hours later, during the deepest stage of sleep, there is a rebound. The sympathetic nervous system overcorrects. Cortisol surges. Blood pressure can reach its highest point of the entire 24-hour cycle at 3 in the morning, precisely when the arterial walls are least protected. A patient I will call Genevieve came to my clinic after repeated episodes of waking with her heart pounding and a sensation of pressure in her chest. She was a light social drinker, 1 glass of wine most evenings, always with dinner. When we fitted her with an ambulatory monitor, her nighttime readings told a clear story. Her pressure peaked at 172/98 between 2 and 4 in the morning, every night she had drunk. When she shifted her wine to earlier in the afternoon and eliminated it entirely in the 2 hours before sleep, her overnight readings normalized within 3 weeks and her morning symptoms resolved. The fourth mechanism is something far less discussed. Grapefruit juice taken alongside certain blood pressure medications, particularly amlodipine and other calcium channel blockers. Grapefruit blocks the liver enzyme responsible for breaking down these drugs. The medication accumulates far beyond its intended level. What was designed to be a gradual, controlled effect becomes unpredictable. That unpredictability is especially dangerous at night when there is no monitoring, no one present to recognize symptoms, and no rapid way to respond. Before I continue, I need to say something clearly and without softening it. Do not change your medication timing, stop any medication, or add any supplement based on what you hear in this video without first speaking to your physician. The information I am sharing is the basis for a better conversation with your doctor, not permission to act independently. Medication adjustments in older adults must be supervised. Some medications, particularly diuretics, should never be moved to bedtime. Your physician needs to review your specific situation before any change is made. This is not a formality. It is the difference between a safe adjustment and a dangerous one. Now, what does the evidence actually support for addressing this problem? The most powerful starting point is getting the right information, which means requesting the right tests, because without them neither you nor your physician can see what is actually happening during those 8 hours of sleep. The first and most important test is ambulatory blood pressure monitoring, known as ABPM. You wear a small cuff for 24 hours while living completely normally. It takes automated readings every 30 minutes, day and night. This is the gold standard for identifying non-dipping patterns and nocturnal hypertension. It is the only way to see your true overnight blood pressure profile. And yet the majority of patients over 65 have never worn one. Ask for it by name at your next appointment. If you do not request it specifically, it will almost certainly never be ordered. The second test is urine microalbumin. This measures microscopic amounts of a protein called albumin that leaks into urine when the kidneys are under sustained pressure stress. Microalbumin is one of the earliest detectable signs of organ damage from prolonged hypertension, appearing years before kidney function visibly declines on standard tests. It is a warning signal while there is still time to change course. The third test is oxidized LDL. You know LDL as the so-called bad cholesterol. Oxidized LDL is what happens when that cholesterol is damaged by free radicals, essentially a corroded form of cholesterol that is far more destructive to arterial walls. Standard cholesterol panels do not measure it. But it is a direct marker of arterial wall damage, exactly what sustained nighttime hypertension accelerates over months and years. These 3 tests together give you a clinical picture that no standard checkup is designed to provide. They are affordable, widely available, and almost never ordered unless you ask for them by name. Beyond testing, the Hygieia trial data points toward one highly specific and actionable conversation to have with your physician. The question of whether your blood pressure medication should be taken at bedtime rather than in the morning. Most antihypertensives are taken in the morning by convention and habit. But the protective effect of most blood pressure medications peaks within a few hours of ingestion and gradually diminishes throughout the day. If you take your medication at 7 in the morning, by midnight its protective window has significantly narrowed, precisely when you may need it most. The Hygieia trial, involving 19,000 patients followed for 6 years, found that bedtime dosing produced a 45% reduction in cardiovascular events compared to morning dosing. Same drugs, same doses, different timing, dramatically different outcomes. Again, do not make this change alone. Ask your physician specifically whether bedtime dosing is appropriate for your medication and your health profile. That question takes 30 seconds and the answer may matter enormously. One additional measure worth discussing with your physician is hibiscus tea, specifically the dried flowers of Hibiscus sabdorifa. Multiple clinical trials have demonstrated consistent reductions of 8 to 14 millimeters of mercury in systolic pressure in patients with mild to moderate hypertension who consumed hibiscus daily. The compound responsible is a class of antioxidants called anthocyanins, which also inhibit the same enzyme targeted by a major class of blood pressure medications. Preparation matters significantly. Use 10 grams of dried flowers, not tea bags or blended products. Steep in water at 90 degrees Celsius for 10 to 15 minutes. The color when properly brewed should be a deep burgundy. If it appears pale, it has not been steeped long enough. 3 cups per day is the dose studied in clinical trials, with the most meaningful timing being 1 to 2 hours before sleep. If you are already taking blood pressure medication, discuss this with your physician before adding hibiscus. The combined effect can be additive and requires medical awareness. Here is exactly what to do with everything you have just heard. Step 1. Check your evening tea cabinet tonight. Look at every label for the words licorice root, glycyrrhiza, sweet root, or natural flavoring in any herbal blend. If you find it, move that product to the morning or remove it entirely. Step 2. Be honest with yourself about evening alcohol. If it is happening regularly and close to bedtime, the rebound pressure spike is occurring at 3 in the morning whether you feel it or not. Consider shifting consumption to earlier in the day. Step 3. Write down these 3 test names and bring them to your next appointment. Ambulatory blood pressure monitoring, urine microalbumin, oxidized LDL. These 3 items are your complete agenda. Fold that paper and keep it with your health documents. Step 4. Ask your physician directly whether bedtime dosing of your blood pressure medication is appropriate for your specific drugs and health profile. Reference the Hygieia trial if it helps frame the conversation. Step 5. If your physician agrees, discuss adding hibiscus tea as a supportive daily measure alongside your existing treatment, not as a replacement for it. One important clarification before we close. Everything discussed today applies to adults with hypertension who are medically stable and whose blood pressure is currently being managed. If you are experiencing a sudden severe headache, vision changes, chest pain, difficulty speaking, weakness on one side, or any other acute symptom, do not watch the rest of this video. Contact emergency services immediately. Additionally, if you have significant kidney disease, heart failure, or take medications that your physician has specifically instructed must be taken in the morning, those instructions take absolute precedence over anything discussed here. This video is about optimization and informed conversation, not about overriding individual medical care. Your daytime blood pressure reading is a starting point, not the complete picture. More than half of adults over 65 are non-dippers, carrying 3 times the cardiovascular risk of people with identical daytime readings, a risk that standard office visits are not designed to detect. The right 3 tests, the right timing conversation, and the right awareness of what is already in your home can change what happens during the 8 hours each night when nobody is watching but your cardiovascular system is working harder than it should. If this video gave you something useful, please hit the like button right now. Leave a comment telling me whether your doctor has ever discussed your nighttime blood pressure with you, and share this with someone over 60 who you care about, because this is exactly the kind of information that gets lost between appointments. Subscribe if you have not already, and I will see you in the next one. Take good care of yourselves.